All right. Good evening, everybody. Welcome to our weekly COVID-19 virtual town hall. Today, we are joined by Brian Leon over here, our epidemiologist for Coos Health and Wellness. And on the phone, we have Commissioner John Sweet. Thank you for joining us, Commissioner.
Thank you.
So since we last and some not so much others, but I think it'd be a good time to discuss some of that tonight. I know we have questions regarding other pieces of the process, like tracking and all that, but I think really quick, one thing I wanted to kind of just go over is what kind of has stayed the same, and then what we know is what stayed the same is our social distancing. Our social distancing is something that has to be maintained, and in all of the phases and all of the things that are open, the social distancing piece is pretty important. Mm-hmm. Right? And that is something that we have to make sure we keep doing. That disinfecting high-touch surfaces, hand washing, are all things we've been pressing since the beginning of this from the prevention standpoint. Don't touch your face. I think that someone asked the other day, like, what's the first thing you're going to do when this opens over? What do you mean?
Eric, this is John. I don't know if it's just me, but I'm barely able to hear you. Can others hear you as well?
How about now?
That's better. Thank you. I'm sorry to interrupt.
No, thank you. Stephen was yelling at me, said he couldn't hear me either, and I said, the Commissioner Sweet can hear me, and then you told me you couldn't hear me, so that's great.
Stephen's deaf, though.
That's true. Okay.
It's you, Eric.
Me. If there's going to be an audio problem, it's going to be with me. We can't go a whole, we can't even start one of these without having someone. Okay, so what we were saying was social distancing is stayed the same. That is super important, 6 feet. Disinfecting the high-touch surfaces, washing your hands. That hopefully will be something that people do for the long haul as far as washing their hands. Don't touch your face. Continue to stay at or near home whenever possible. And the vulnerable population guidance is still the same as far as minimized non-essential travel, outside walking, hiking, or home telecommuting. What's changed is we can have gatherings up to 25 people, provided we can maintain the social distancing, right?
Yep.
Get back to that social distancing. Restaurants for sit down and additional restaurants have additional guidance to the Oregon Health Authority. Personal services like giving your touch. Those also are open with additional guidance from Oregon Health Authority. Gyms, as long as you're not using the locker room, the sauna, the hot tub, or the pool. So if you want to go just work out, you have the ability to work out, and they have additional guidance as well. And some following retail businesses, furniture stores, ShopRite, things like that. They all have retail guidance through the Oregon Health Authority. And honestly, if there's any questions or you own a business or you want to go to one of these things, the best place to do is ask the Oregon Health Authority. They're the ones that really have an understanding of where guidance is leading people, and they kind of need to know where the gray areas are. Mm-hmm. So that's kind of been our suggestion, is to, if you've got specific questions regarding where you want to fall into any one of these that you want to get a hold of HHS, and they can give you what they would interpret their guidance is.
And they're also getting just kind of collecting that data about the types of questions that people are asking, so that they can identify what some of the gaps are, or what are at least interpreted to be the gaps, so that they can put out, FAQs and things along those lines to further help. So that is also going to help them help us if you ask questions of them.
His mic still sounds bad. You're fine.
I'm sounding good.
You're perfect.
Well, I appreciate that.
You're way better off than I am, apparently. All right, so we'll just keep going. Is there anything that, Brian, do you have any updates you'd like to give the community?
I don't have anything specific right now. Let's see what some of the questions come through, and maybe something will pop.
Commissioner Sweet, is there anything that you'd like to say before we get started with the questions?
Well, if you're curious about our parks, that was kind of a new opening. Everything went very quietly and well last weekend. This weekend, we're expecting more people, so that'll be a better test.
Good.
Can you hear me okay? Eric, I'm still having a hard time hearing you, and it sounds like there's a wind blowing through the telephones here.
Yeah. Brian's gonna have to talk for me.
Brian did a great job.
He's doing really great with his. I think that's what happened is I gave him my mic from last week.
Yeah, usually people have a harder time hearing.
You should throw out the one you have.
Just about the time we get this all figured out is the last time we're going to do this. I would imagine.
I doubt it'll be the last. Well, I'll be figured out faster than that.
I guess we'll see. Oh. I'll just scream at you.
There, that sounds better.
Okay, so let's see. Let's start with we have the age-old question we get every week. How many of the Shutter Creek Correctional Institute cases are Coos? They prison or are they out?
So we have 30 total cases that are treated right now. 8 of those cases are Shutter Creek. So we'll start with those. Of those, 25 of those cases, and upon every positive confirmation, those individuals were transferred to another facility where they can have more appropriate level of medical care based on their health status. There have been some individuals in that group that have covered, and they have essentially went to other facilities, not Shutter Creek, but they went through a whole period of time where they were tested, came back negative, symptoms were monitored, they had completely recovered. So they were transferred to other facilities. We weren't told where, but they did not come back to Shutter Creek. 2 of them were lab confirmed cases, and one of them is what we are calling a case. To say there's someone that has been identified as a close contact of a confirmed case, but they themselves have not received lab confirmation, but they have to kind of keep this simple, the symptom profile that matches COVID-19. Like I said, they were a close contact, meaning we're within 6 feet for at least 15 minutes of path going forward for presumptive cases. We are urging them to be tested. However, only a positive test would change their status. That would upgrade their status to confirmed. But even a negative result would not change status of presumptive positive. And there are there's a potential for false negatives based on a number of factors. We feel that they're on the side of positive and treat them as if they are a confirmed case, essentially, which means fully investigated contact tracing, all those things we've heard about as part of from the epidemiology aspect to control the spread. So that leaves 2 cases out of the 30 that were community-based cases. They had no connections to Shutter Creek. One of them was lab confirmed, and the other one was, again, a presumptive positive. They were a household member of that first confirmed case that I just mentioned, the first community case that I mentioned. So I think that gives out the whole 30 case breakdown. Is madly and chaotically in technology concerns and issues. I don't know how much longer I can string this out, but I am speaking more and more slowly.
Yeah. Well, I on here now, as far as that goes. All right, well then let's switch to microphones. I'm gonna get there. In positive note, people are very time and fun talking about it. That's good.
Just swallow the mic, man.
Yeah.
I'm also now getting right up close.
Yeah.
I don't know if there's a.
Well, it shows now. John, can you hear us?
Yeah, finally.
Finally. Yeah. Well, bad microphone. Great microphone last week.
I can't hear you though, Eric.
Yeah, it's like either cord. How about now?
That was good.
Your microphone. Just turn it off.
Mine is going. We'll turn it off. We're just going to use that microphone there. Yep.
There you go. All right. Well, we're going to try this with our old faithful.
Old sort of faithful.
Old reliable. Okay. Is
All right.
that better? What? This is why we can't have nice things. Okay. All right. Here, question on reopening. Margaret asks, if a business is not following safe protocols or physical distancing, who do we contact? Coos Health and Wellness? Who enforces the mandates? Who do we call on weekends? It's a great question.
That is a great question.
I think that there's a lot of different things. I mean, you can do as far as it depends on what it is. OSHA is one of them that you can contact. That's probably the best one right now that we know of. We're still answering all those questions, and that's again that would be something that would be good to ask Oregon Health Authority. So that with this whole new opening thing, I think it leaves a lot of questions as to what it means for different pockets of the community. We're all still trying to answer that question. So hopefully, Margaret, we can get you a better answer after talking to Oregon Health Authority. Oh, do we have any recovery numbers I know that that's come up before,
Mhm.
but is that something that we're going to discuss at all?
So probably not locally. There are a few things that go into what the state is using to describe and define recovery. Unlike I think what maybe some people are under the impression of, it does not require a negative test result. It is, and there are those in the state that are working on getting some recovery information from our cases and other counties' cases, but that is not something that we are tracking locally. So I think that's why you may see information about recovered cases at the state level, but you're not seeing that generally with local jurisdictions. Not saying that we might not have something in place to do that later, but that's not something we're doing right now.
So another question regarding testing. It was reported that the presumptives were tested and negative. So are they being retested, or are they always just counted as presumptive?
They will always be counted as presumptive for the rest of their lives. It's essentially, to add a little bit more to that, so in almost every single way, we are treating presumptive cases as if they were lab confirmed cases. And just because someone has recovered doesn't mean that we're now reducing our confirmed case count. Those cases are there, they will always be there. That is the same thing for presumptive cases as well.
Okay. Good question, and Commissioner Sweet, this might be something that you can answer. The question is, will the national recreation areas soon open?
Well, if you can consider the dunes as a recreation area, they did open the dunes to riding last Friday. They did not open their campgrounds or restroom facilities. And they said they would do that in due course, but didn't give much of a hint when that might be.
Okay. That's pretty standard right now for almost all the parks, isn't it? As far as the restroom thing?
I suspect they're waiting, or my suspicion is that they are waiting for the state to decide to open their state parks to camping, not just to day use.
Okay.
Does that make sense?
Yeah, I
think they're working together.
As much as any of it makes sense, I think that we're kind of in this period where we have to put things together to make things work, and it just sometimes doesn't, like what you're used to thinking, like, oh, I'm going to go camping and I've got this and this and this, right, and that I could access, like saying if you were going to take a shower or those things. But that's one of the reasons why that self-contained camping piece was put in place, especially by you guys, right, is so that someone can still enjoy camping and then still have that all within their own RV.
Yeah, and frankly, we're torn. It's a shame that one has to own an RV or a camper to go camping. I wish we could open it up to tent campers, because not everyone can afford an RV. But I don't know how to keep the restrooms sanitized to a standard that would be expected, given how contagious this virus is. Now the state of Washington implemented a program, I'm told, that simply says the restrooms are not sanitized. Bring your own materials and sanitizers if you wish to use them. And I would assume they'd have something there about at your own risk, but I don't know that. But our state has not given us the green light to do that yet.
Okay. Thank you. So Tom asks, I'm with Southwestern Oregon Veterans Outreach located in Pony Village Mall. Is it permissible for us to reopen and under what restrictions? They do veteran services for Marine Corps League, and they have a smaller office in the upper part, the mezzanine piece of the mall.
Okay.
I would assume that provided they follow the social distancing guidelines and wear proper PPE, like i.e. masks, that they would be able to go about helping veterans receive those services as long as they can maintain that 6-foot social distancing. And that's just our version of it, but you might want to, again, touch base with OHA. It is a service that would be able to open based on what I understand of phase 1, and most of that has everything to do with your ability to maintain social distance and keep the numbers down inside your facility. And it's a smaller office, so they're not going to get more than 10 people in there anyway.
Yeah.
Yes, I answered that. As a small business owner, I'm having a hard time finding personal protective equipment and hand sanitizer. Do you know where I can find some? I think everybody's having this problem. The best place right now, I think, locally would probably be SOIB, as far as if you're a small business. If you go to Southwestern Oregon Investment Board.
Workforce
Investment Board. You go to their website. SOIB. It's right here. My PIO actually put this below for me to read. I just obviously can't read. It's SOWIB, SOWIB supply.com, and you'd be able to most likely get some of the things that you need from there from a local standpoint. I know that everybody's run into that with all of the PPE things or requirements within the framework, that it's low. The supplies are pretty low. I had another one, and this one, Brian, where'd it go? I read this note. Oh. Would seniors be safe volunteering at a food bank in Coquille on May 29th? The organizer was told that with precautions, she would be exposed to no more than a low dose of the virus. Is there such a thing as a low dose of virus?
Oh boy. Yeah, I'm not sure that advice was grounded in any science. I would say that anyone in the risk categories that we've been talking about since the beginning, anybody with underlying health conditions of cardiac nature or respiratory nature, diabetes, some of those other conditions, again, the folks that are 60 and over, people with immune suppressive conditions. I would, opening up, just because we're saying it's okay for this business to open up under certain conditions does not mean that your risk has suddenly evaporated. You still have a lot of risk there. The dose, for those of you that are kind of unfamiliar with this word in the context of what we're talking about, the infectious amount of viral particles that would be needed to get through into your body and cause illness. We don't know what that number is. We don't know really what is required and how light of an exposure that you can come across in order to be kind of meet that threshold of risk where we're really worried about you. So that's certainly an indication that whoever was giving that advice, I've not seen anything like that in any kind of expertise wheelhouse. So
So would you say that if you're a senior, you're in the vulnerable population anyway, right?
Mm-hmm.
So it may behoove you to not participate in something where you're going to be in close contact with the community for an extended period of time based on the fact that they are in that vulnerable population?
Yes.
Okay.
Yeah. Like if my parents were asking me right now
If it was okay
hey,
if they did that?
could we go do some volunteering in a place like this where there's a lot of high touch things going on? I'd be like, absolutely not. It's just
No, I think
that's why
that's fair.
that's the advice I'd give my own parents.
I think that's fair. Tara Johnson asks, are masks required by every person at a business, or is it dependent upon the type of business? There are different requirements for different sectors, Tara. So you would want to look at what specific sector that you would be worried about, and then see what it says in there. A lot of them are required to have masks as for employees go, but not all of them. So that would be a sector specific answer. And if it's at a place that may not have its own clean sector, you would definitely want to reach out to Oregon Health Authority and say, hey, I work at this place that doesn't fall into either of these. What would your guidance be? I think that it's always best to err on the side of caution if you're at a place and you don't necessarily know if you should be required to wear a mask. I mean, it's not going to hurt you to wear a mask. I mean, it's not going to be comfortable, but
yeah.
Let's see. So do we have, Rick wants to know if there are any specific plans for testing, isolation, or quarantine is required. I know that the guidance has specific testing as far as we have, I think the region or our area is supposed to test. Is it 192 a week?
Is that what the question meant?
I don't know. It says, what are the specific plans for testing, isolate, and quarantine is required? There's no specifics as to what sector he means.
Yeah, what you were saying earlier, there is, I think it was 192 or 193 tests per week was eventually the threshold that we were going to be trying to meet as part of some of the guidance that we have for reopening.
Right.
That is the eventual target. That's not a level of test that we're meeting right now, but there are, I believe, plans in place for additional sources of testing to become available here pretty soon. I'm still not really clear as to how that relates to the isolation quarantine part of that question. But
maybe what I think if you went from there, say, okay, someone was tested and then they were positive, or even maybe they were a presumptive case that had a negative but still had the symptomology of a positive case. What would the plans for isolation and quarantine be? I know that in certain groups, I know that some people have isolated themselves in their RV outside so that they weren't near their families, but they had the opportunity to do so. I know that the guidance says that any individual that does not have the ability to isolate themselves safely at home then need to be isolated, most likely at a hotel or something like that. It's the only thing I could think of as far as.
Yeah, any confirmed case or presumptive case, we're going to treat as that individual needs to be isolated, and we will try to find a way to make it happen if there is a lack of opportunity to do so.
Commissioner Sweet, are the beaches and access to the beaches open?
The beaches have always been open. Access has been somewhat limited, significantly limited. Here locally, State Parks has opened most of their parks here in the South Coast to day use only, not camping. So, and the U.S. Forest Service has opened access to the dunes, to the beaches there. The BLM has open access to the beaches. Bassendorf Beach is a prime example of that. Monday morning, of this week. They opened that up. Someone else opened it up last Friday, so they apparently couldn't wait until Monday to move the blockades. State parks, as far as I know, all the little waysides, South Abandon, Sunset Beach. If you can hike down from other waysides between Sunset and Cape Arago, the little beaches there would be open. The beach at Bandon, I believe, is open. I was down there last weekend. The parking lot there at Coquille Point was open again, had been closed a week prior. So I think our beaches are, now not all the counties along the coast have accepted the offer to open access to the beaches. Some of the northern counties, I think, have been a little more restrictive than we've been down here. They had been inundated with spring break tourists heavily from Washington, where the disease was so rampant. And so they really closed things down tight.
Mm-hmm.
Any specific questions I might try to answer regarding beaches?
No, that was the question itself was, are they open or is access open? I know that even since this whole thing started, the Stay Home, Stay Safe, there were always pictures of people at the beach.
Yeah.
It was just whether or not the roads were open to get there. And like you said, it seems as though someone found it far more important to get to the beach than the roadblock would indicate. But it's been happening, I guess. So, Tara had a question about that testing number. Is that a mandatory number that has to be met, or is it the number is the goal for the county? 192 a week is a lot.
It's a lot.
And I think we're still waiting on. We still have some questions, I think, regarding that. I would imagine, as far as like, we might not need to test 192 people in a week if there's no symptoms, right?
Right.
So
right. Right. Yeah. Really, I think the easiest way to answer that is there is a certain amount of clarification that is needed. There were some, I think, items that really just kind of required a plan. A lot of the testing capacity depends on a lot of factors outside our county. And so I think the understanding there is, expanding is going to require, assistance from the state, assistance from community partners, business partners that may be able to help and add a degree of testing. So, but there's also, testing being done for groups of people that it hasn't been done before. Now that some of our medical partners have opened things up, like non-elective surgeries, there's some screening that is happening. So there's a lot of different avenues we could end up kind of scaling up and getting to that level of testing. It's just not something that is happening right this second, but I think there are plans in place to get there.
Right. I know there's been a lot of conversations between the,
yeah.
And that kind of brings up, we've had a couple questions regarding the antibodies testing. Like, what's the difference between the antibody serology test and the viral PCR test? And then someone asked if we had any numbers regarding the antibody test.
No. So right now, like, negative test results for antibodies are not required to be reported. And again, antibody testing was not ever something we were going to be looking at real time. It just tells us that an individual, a positive result just tells us that an individual may have been exposed to COVID-19. It doesn't even necessarily mean they were infected at one point. There are a few things there. And so really, we're just kind of probably going to be attempting to analyze like a large amount of results to get an idea of what maybe the actual potential exposure level in a community. since they've come out, there still has really not been any strong guidance for how these test results can be most leveraged, I guess, to kind of get a better understanding of what transmission has been like. But to go back actually to the first question, the serology tests or somebody takes a blood sample, that is really just looking for our body's reaction to being exposed to an illness. It is not actually detecting any evidence of virus in our body, as far as direct evidence of viral particles. Whereas the PCR test is looking for exactly that genetic material that is unique to the virus that we're worried about. That process takes longer. In addition, the antibody results require that the infection has, or the exposure has, it is a little ways in the past. If someone were exposed today to the virus that causes COVID-19, they would not test positive tomorrow for an antibodies test, and likely not test positive 4 or 5 days from now. We're all different, but it takes a little while for the immune system to start developing antibodies to an illness in enough of an amount that we can feel good about the fact that it would show up on the test.
Do you need Jenny had asked if there was any of that antibody testing in the medical center. I think it's just Coquille Valley.
As far as the broad offer of testing to the public that they have been doing, I believe that may be true. I don't necessarily know that antibody testing isn't available elsewhere, but certainly I don't believe broadly. I think they if there is testing available, it's used for a very specific purpose.
Right.
But you would have to contact those providers to talk to them about that.
But as of right now, if you wanted to just go get one without the requirement of your provider giving you an order to do so, you could call Coquille Valley.
I believe they are still absolutely available to do that.
I had a question, and we don't really have an answer. If we do, the question was, does general aviation have any restrictions? And we have not been notified. I know, as far as if you look at the OHA site, the government website, governor's website, you won't see anything regarding the general aviation field, like FAA stuff, as far as requirements for if you get on a plane. I don't know that that's something that the state would do. That would probably be a federal thing, and that's not something that I've been made aware of at all. So if you ask that question, that would probably be something you'd want to maybe the FAA. I know that doesn't necessarily sound like they do, but they might at some point.
Yeah.
It was a good question though, because you see a lot of that online where people are sharing videos on their plane, and like over half the people don't have any PPE on.
Right.
I guess that could make some people very nervous.
Sure.
Commissioner Sweet, someone had asked, and I think you may have touched on this a bit earlier, but do you know when they're just going to open regular camping at any point? Do you see in the future, is it going to be a while before they just open it up to just general camping? That it might just have to stay with that self-contained piece for a while?
I'm not sure. That depends largely on what the state would allow us to do during phase 2, Eric.
Yeah.
That would be the soonest we could anticipate it. I assume you mean by normal camping, you could take a tent and go camping at one of our parks, and you wouldn't, right now we're only utilizing every other camping spot in the park to make sure, or campgrounds, to make sure that social distancing is maintained. I think we're going to have to get through phase 1, and then before we're able to change anything. And even then, I don't know what will be allowed.
Sure. Yeah, I think that's the big thing is we have got to get through phase 1 first.
Right.
And that is 2.5 weeks away if everything goes smoothly, right? Because it's 21 days, so June.
And then I think you have to also keep in mind that I don't know quite how much data we'll have. This is just my own. I'm not privy to the state's thinking, but each day that goes by, we're collecting more data, either good or bad. Ours has mainly been good. But I'm not so sure we're going to have all that data collected on the 21st day, and then on the 22nd day, be able to move to the next phase. So I think we have to kind of wait and see how this all unfolds. And I would urge everyone to be patient, to be very, very cautious. If you have any doubt, be conservative. This is an intensely, what's the word? It spreads quickly. And particularly, and we know as we reopen the economy, there's going to be more risk.
Mm-hmm.
And we've had a couple of questions relating to older people or people with compromised health systems. And they're going to have to be especially cautious. They can't treat this like they're a teenager or even a young adult anymore. And, I don't know that you get a little bit of this virus. It's kind of like being pregnant. There ain't such a thing as a little bit pregnant. I'm not so sure there's such a thing as a little bit COVID-19.
It reminds me of.
I think common sense is going to have to rule the day.
Yeah.
I don't think it's possible for the government, any government, to anticipate every situation that every individual, person, and business in this state will encounter during each day of their life. So they can give us a guideline, but it's going to take common sense to know what each of us should do.
Yeah, it's definitely a moving target.
Are there. Stay clean, stay guarded, minimize contact. It doesn't mean you have to become a hermit. And people do need to get out and exercise and see other people. And we can do those things, but we have to do them judiciously.
Right. No, you're absolutely right. It's ultimately what it comes right down to is for us to even move through this phase, the community has to work together, take care of each other, care about what, not necessarily doing all those prevention measures necessarily just for themselves, but for the other person, for their parents, for their grandparents, for their aunts or uncles. I unfortunately do not fit into young adult or teenager anymore. And that kind of broke my heart right there. I've got one for right in your wheelhouse, Brian. Ready? So there seems to be several tracker or tracer courses available online. Do you recommend a particular one, and do you foresee the need for this service in our community? I'm happy to take the training, but don't know if it is relevant in our community.
That is a really good question. So I am already aware of several. I've had some very well-meaning people, send links. I'm familiar with a lot of the organizations that are putting that on. I know the state is also going through some training programs as well that they're going to be offering for those that are at county health departments. A lot of those are obviously many hours long. We certainly have identified some training that we're mostly probably going to be relying on the state's training program only just for consistency's sake. But really, the basics of contact tracing are going to be fairly universal. And so I would say as long as the source that you're looking at, is reputable, then I would think that that's probably going to be some good content. But yeah, we unfortunately, with everything going on, there certainly hasn't been time for us to go through half a dozen 4, 5, 6 hour long trainings to kind of judge their content. I like I said, as long as the organization is reputable, I would feel comfortable with taking that training. And there's not likely to be a tremendous difference between what that training looks like between the different options.
Right. I mean, there very well could be, like you said, an increased need for contact tracers, right? I mean, we're supposed to have 10.
Yep.
That's the plan. In the event that we would need to utilize all 10 at a time, would be a pretty severe situation.
Right.
But it is nice that stuff is out there to get these people up to speed. But ultimately, what it comes right down to is, no matter what training you take, you still need to really understand the needs of the organization.
Right.
Right. Like for us, for example, we have contact tracers, but regardless of the actual training they take, you are the one that really gets them up to speed on what it means for us here and what we expect out of our contact tracers. Right? Like boot camp, contact tracing drill sergeant.
I hope it's not quite that rough, but yeah.
Like Air Force boot camp. I know that we had a lot of people say that they weren't able to catch your Shutter Creek answer because we apparently had some audio problems. Do you want to try to, you want to try to rethink that one?
Yeah, we can try to cruise through that again.
We could try to because there was a lot of like, oh, we didn't hear it. What was?
Yeah, no
we're real sorry about that.
No problem. This won't be the first time this week I've had to review myself.
That's true. How many of the Shutter Creek Correctional Institute cases are still in Coos County? Are they inside the prison or are they out?
Okay. So the information I tried to offer earlier was essentially just trying to answer that question by going over and breaking down the current 30 cases that we have attributed to our county. 28 of those cases are attributed to a connection to Shutter Creek, whether they be staff members or adults in custody. Out of those 28, 25 were adults in custody. They are no longer in Shutter Creek. Any positive test result was then transferred up to a different facility by the Department of Corrections in order to be able to get more round-the-clock medical supervision by basically just the resources were there to be able to make sure someone was taken care of. Some of those have recovered, but they have been transferred to other facilities, not back down to Shutter Creek. There are a couple of individuals that did end up being transferred or were tested prior to being released and then released. Those individuals so far have been asymptomatic and went through the monitoring phase without incident as far as us being concerned that there may have been exposures. The 3 individuals out of the 28 that I haven't discussed were staff members. 2 of those were confirmed cases, and one of them is a prospective positive case, which we'll talk about here in a minute. And then that takes care of the 28 Shutter Creek related cases. There are 2 cases that are community transmission, is the essentially just a way of saying we're not really sure where it came from. There was no connection to Shutter Creek. There was not a discovery of a specific person that they may have gotten it from. But one of those 2 individuals was lab confirmed, and then the prospective positive or presumptive positive case was in the same household. Okay, so presumptive positive cases, if I can't remember, was this part of the same question that I answered, or did we go into that?
That was a different question.
Okay, so presumptive positive cases are just cases that you know, we are treating like confirmed cases. They have close contact with a confirmed case, but maybe they have not tested positive, whether that means they haven't been tested or they tested negative.
Right. Okay. Thank you.
Yeah, no problem.
Question, some stores have started supplying some stores have started
Having
supplying,
audio problems again?
Yep.
Okay.
Yeah, my audio is cutting out. Have started supplying disposable plastic bags that had been banned in January in order to avoid handling people's reusable bags. Has the law been relaxed in light of the pandemic? I actually have an answer to that question because I Googled it while you were talking, because I heard your answer already once. The answer to that question is actually that on April 21st, 2020, the states, due to the COVID-19 outbreak, DEQ has important information to share about the single-use bag ban. Oregon has not taken statewide action to suspend the plastic bag ban, also known as House Bill 2509, but due to supply chain concerns, grocery stores might run out of paper bags and have to use plastic bags. Municipalities and local governments are the administrators of the law and can make decisions about enforcement. During the COVID-19 pandemic, we encourage local governments to not penalize grocers for using plastic bags. We also encourage the public to keep using reusable bags if they have them. So that is all I know about that subject. If you can Google that, and there are some PDF documents that you can look at as far as COVID-19 and reusable bags that might interest you on Oregon.gov. So that is as far as I
That's
can.
a very
delve into
well-rounded anscer.
Yeah,
Yeah.
they did a good job. I was actually wondering about that too. This person brings up wonderful points, because all of a sudden it was there. They were bags there. Yeah. So thank you for asking that question. I got to learn a little something myself. Commissioner,
this is. Oh, I want to add on a little bit to that, if I may.
Yeah.
You know, since plastic bags were outlawed, I quit using bags altogether. I simply reload my groceries into my cart, shopping cart, wheel it to my car, put it in the back seat or front seat, depending whether Michelle's with me or not, and unload them at home. We really don't need bags. It doesn't have to be a big issue.
Yeah, well, you know, I have often gone into the store and left with all of my groceries in my cart as well, but only because I forgot my bag in my car.
Well, that's what happens to me. That's what happens to me all the time, but it still works.
No, you're right. You're right.
No, really?
Yeah, I've walked out to my car and then loaded them in the reusable bag so that I could carry them in the house. So you're right. I mean, you're definitely that. I think we've kind of learned in the last few months that we
how to
cope without bags.
Yeah, I just don't think it needs to be an issue.
No. Nope. Someone posted that you believe the plastic bags that have been given are stronger than the banned single-use plastic bags. I know at Walmart those bags are supposed to be reusable and recyclable, those bigger, thicker ones. Harder to clean up after the dog with them though. They're not as pliable with your hand.
Unbelievable.
Okay, Commissioner, do you have anything you'd like to say before we close her out?
No, I thank you and your public health group for holding this, and I thank people for calling in. I particularly thank them for calling in. We want to do this right. We do need to reopen our economy, but we also have to balance that with care for each other. And this is going to be around for a while, quite a while, and we're going to have to. We can't shut down for the duration of how long this might or might not be around. We're going to have to learn to live with it, and that's going to take some changes. And as someone said to me once, it will turn into a contest, and each one of us will have to play this out to our own conscience between individual rights and common sense. And I really think, so far from what I've seen, common sense is prevailing. And I'm so proud of what's happened in this county and how we've, with the exception of Shutters Creek, really done a great job controlling the level of the spread of the virus. So thank you, everyone, for your efforts.
All right. Yeah, we're definitely adjusting on the fly with what this means for all of us in the community. But again, what it really comes down to is that we all have to work together in order to keep us moving in the right direction. And I guess we'll just keep doing that. So we will meet back here next week. Hopefully, sans, I'm not even going to say that we're not going to have technical problems. We probably will. We're going to get this figured out though. So till next week, we'll see everyone later, and have a good night. Have a good week. Stay safe.
Thanks, Sherry.
Thanks, Michelle.